Today's a really exciting day for us at Velindre University NHS Trust. Opening Velindre at is a really important milestone on our journey towards transforming cancer services for Wales.
It's great to be at the fantastic Velindre at Nevill Hall Radiotherapy unit, and it's a fantastic cutting-edge facility in a wonderful building in an extraordinary setting, making it much easier for patients to be able to access their radiotherapy conveniently.
It's about making sure we have more capacity to treat the growing demand for cancer services. And it's about making sure that we've got world-class kit and equipment.
This is a fabulous facility full of equipment that is hardly anywhere else in the UK. And that means that we can give the valleys, communities and the people of Abergavenny and its environs really modern, accessible care.
Just incredible technology here, using artificial intelligence to reduce the number of times patients have to come here, increase the precision of treatment. It's genuinely world leading.
This project has been a fantastic example of what good partnership looks like, particularly with our colleagues in the Aneurin Bevan University Health Board, but also with the wider NHS, our colleagues in the other health boards and the rest of the NHS system, and of course Welsh Government. And really important partnerships with industry, such as Ddwyrain, who are a global leader in the producers of linear accelerators and radiotherapy equipment.
It's been a real pleasure and an inspiration to work with Felindre.
Together we've achieved something very special, which will improve outcomes for patients across South East Wales and hopefully support us in our next venture in moving into the new Velindre Cancer Centre in April 2027. Without the collaboration, partnership working and just true sense of inspiration of what we were trying to do, we wouldn't be able to get this facility open on time.
I want to say thank you to everyone who's been part of creating it, but also to all the staff who come into work here day in, day out, giving the best possible care to the patients.